Welcome, everybody, and thank you so much for joining us this evening for tonight's webinar presented by Laneways Rehabilitation and Ergonomics about how to avoid aches and pains when starting exercise as a person in a larger body. I can see lots of people actually jumping in right now. Thank you so much for joining us this evening. It is lovely to see you here. Now, while we're waiting for quite a large volume of attendees to come into our Zoom room, we'd love for you to say hello to us in the chat so that we know that everything in the chat is working. So if you can give us a little hello in that chat, and we can start to see some people saying hi and making sure that that is all working well. Now, this is an interactive session, so the chat function will be used regularly. Hi, Sophie, Nicole, Sam, well done. Nice to see you here. Mandy, Mary, nice to see you. We've got lots of people coming. Catherine, nice to see you. It's great to see everybody here. Now, what we're going to do tonight is have a presentation by the wonderful Nadia Walton, and she is going to give us lots of information to help us really get started with exercise and avoid those aches and pains. Before we start, I'd like to acknowledge the traditional custodians of this land, and we pay our respects to elders past, present, and emerging. Now, tonight's session is being recorded, so we get what it's like. You might have kids in the background that aren't yet asleep and all of those kinds of things that take our attention away. It is being recorded, so if you have to pop away for a bit, you will receive a recording via email in the next few days. But we do appreciate you being here. It's great to see so many people jumping into that chat. Now, whilst we love this lively chat, we do want to remind you that please refrain from posting any medically related information in that chat, because we need to treat this as a public forum and we want to ensure that your privacy is maintained. Now, we are, of course, happy to answer any of your questions as we go through this presentation. And if you're able to put your questions in the Q&A section at the bottom of your screen, that would be amazing. Then I can keep track of those questions, because sometimes the chat gets a little bit lively and those questions will disappear from my screen. So it'd be great if you're able to do that. Now, I also wanted to ask you, what are your challenges when it comes to getting started with exercise? It might be that you might just not like exercise, or every time you try, you have a setback because there may be a particular, health issue or aches and pains and things that come up for you. It might be that you're juggling a million things in life and with family and work and all of those types of things, and you find it really hard to find the time to really dedicate to yourself. So if you can let us know in the chat, have a think about it. What is your biggest challenge when you are trying to start with exercise? Awesome. Thank you. There's a couple of people already putting those in there. I would like to mention, if you just wanted to chat with us panelists rather than with everybody, there is a little function on the chat button where you are able to do that. So please feel free to make that happen for you if you don't want to share it with the rest of the group, and only Nadia and myself will see that. Now, I'd like to introduce to you Nadia Walton from Laneways Rehabilitation and Ergonomics. Nadia is a physiotherapist in Melbourne who does a lot of telehealth. So if you're not based in Melbourne, that is okay. She has a focus on caring for larger bodies and she's a bariatric care consultant. She's dedicated to improving healthcare experiences for people in larger bodies by providing hands-on physiotherapy and really advocating for size inclusivity and care. And certainly, she supports a lot of healthcare services to enhance their capability in bariatric care through her practice Laneways Rehabilitation and Ergonomics. She also champions equitable, evidence-based care that prioritizes dignity, mobility, and overall well-being. So welcome, Nadia. It is lovely to have you here this evening. How are you?
Really good, thanks. Thank you everyone for attending. It feels very lucky that you've taken the time out to work through what we can do tonight.
Absolutely, Nadia. Now you are the expert. You're the go-to. You are really that key opinion leader in the area of helping people in larger bodies. So can you tell us about, how can we start this exercise process without having these setbacks all the time?
Yeah, I will. So I wanted to start by acknowledging my thin privilege. And so what that means in the healthcare space is that healthcare has been designed for me. And so when we're accessing healthcare, and this is not so much what we're going to be talking about tonight, but it's what I do in a huge amount of my job is around acknowledging that the experience and trying to improve the experience for people in larger bodies. But so I my experience and my expertise are clinical expertise, and that I spend so much of my day working with people in larger bodies, but it's not a personal experience. And I really want to start with that acknowledgement. And then I wanted to talk about a couple of patients who are representative of who I see, and exactly what I saw just come through the chat about what the barriers to sort of getting started or keep going. So I have some patients who the pain or the conditions. So sorry, let's go back. You're all here because you value exercise primarily. You see that it's maybe good for your health. And for some of you, you might be also seeing that that's an element to your weight management. It might also be, no, you might also know, yeah. You might also know that exercise makes you feel good once you've done it. There's also equally a lot of people that hate exercise, but they know they should do it for their health. And so we're sort of here with that premise. You know you should be doing it. You potentially maybe want to because you like it, or you want to because you know it's good for your health and your future. But that's kind of the premise we're going to work on. So but the barrier to getting started can be many and varied. So I have certain patients where the conditions that they're holding, so it might be that they have really grotty knees, it might be that they have terrible back pain, it might be that they've had some wrist injuries, and so they'd like to go to Pilates, but they have really sore and painful wrists. And so it's that getting started, and there's a genuine, very genuine physical healthcare block. So I have patients like that. I also have patients where the day is just too busy, the week is just too busy, and the energy is just not there, because it's sort of lower down the list, rightly so for lots of people. We've got to earn money, we've got to look after the kids, we've got to look after the grandkids, and it becomes kind of lower on the priority list. And so it is on the list, but it's too far down. That's another group. And then there's another group that maybe are fearful about their future if they don't exercise. So they believe that exercise is going to give them a better chance at a long and healthy life, and they're fearful about not living a long and healthy life, sometimes because they've seen parents often who maybe, and they think, I'm heading in that direction, I really need to not head in that direction, so I need to make a change. So I actually don't really want to do it. I don't get the pleasure from exercise, but I don't want to end up the way my mother has ended up. So those sort of three of the kind of key groups I see often. There is another group, although I think increasingly with the internet, we've kind of got around that, but a bit of exactly what Lisa put in the chat just then. I don't feel like I can be in a space for other people exercising because I feel too visible because of my body. I think things are shifting in that group, at least, because at least now we have the internet where we can, do an online yoga class or something. But so they tend to be the commonalities around what I see. There are also some very physical barriers to wanting to exercise around skin. So it can hurt if you have loose skin or if you have chafing. Continence can be a barrier where, I would like to go for a walk, but I don't trust my bladder. So that's and that's a very genuine reason to kind of not want to exercise. And then when you're busy and you're putting it way, like I'd put it, you would put it right down the list because it doesn't feel very good. So how do we get sorted and how do we kind of work through that? So because we're talking about this group of people that are very disparate, I'm going to give some examples and I want you to think about what tools what might work for your personal toolbox. So not everything is going to apply to you. What some examples and some ideas. Where often we need to think about is what are my choices and what is possible as far as exercise. So if I have terrible knees, we know that offloading them in the pool would be an ideal, it's great, it offloads them. But there is absolutely no way I'm going to get into a public pool in my bathers. So it's not part of your choice list, okay? Or I live very remotely, and so there is not the yoga, the Pilates, the karate, there is simply not many other services. So again, what are my choices? And we need to be really specific about why you're choosing your choice. You sort of need to kind of think about what might be your driver. And this will come back to how we kind of think about this going forward. So if you feel like you have no idea what you might like to do. So there's a couple of ways you might think about exercise. You might think about exercise that's super, super efficient because you're really busy and you actually really hate it. So examples might be a weighted vest and a hill, some resistance on a bike. But I'm sure there's people sitting there going, yeah, but my knees won't tolerate that. Well, it's not part of your choice list, okay? And so when you're starting to think about what can I do, you need to think about what can I possibly fit in my day, what's available to me, what's available to me from a cost perspective. So if the classes you want to do are actually going to cost much more than you can afford long term, and everything we're looking for is long term, then it's not a good strategy. It's not part of your kind of what could I possibly do. And if you need, and then thinking about what time do I have available? We talked about cost. We talked about what that sort of exercise or what that sort of thing is actually going to, where it's going to be loading me. So if you've got really terrible knees, bikes for most people are not a great solution. So, not sort of thinking about that as an option, but what else is available to me? And then how much do I need to do to get the results I want to get? So that is really important that you reflect on the reason you're going to exercise or you want to exercise. And for most people, it's not one reason. For most people, it's a whole range of exercises, a whole range of reasons you might exercise. So for example, one of my patients, Jane, might exercise or feels she needs to exercise because she's concerned about turning into her mother, and her mother didn't live a long life and was fairly sick towards the end. So her motivation is not actually sort of internal. It's much more, I'm fearful of what the future might bring. And she sort of feels like she should do exercise, okay? Someone like Jane is less likely to get on to start an exercise program and go bananas. She's actually going to much more struggle with the motivation. Yeah. Someone who has very clear goals of weight loss or has started on a GLP-1 medication, their motivation tends to be, I'm spending a lot of money and I've made this really big change, or I'm really restricting my calories and I'm really going for weight loss. They are likely to over-exercise. Yeah. And if you then factor that component of what is my motivation and motivations with, so what are my motivations with what are my conditions and what is my history? So I've had 4 knee arthroscopes and I tend to get hamstring strains. Yeah. And you add that with, I'm super duper duper motivated because I've just started on a GLP-1 and I really need to change. And I've invested money, and you've had those conversations with the medical team and, you're on, and then you've got these injuries. These are the guys that I tend to be like, motivation is not the thing we need to focus on. When are we going to do rest days? When are we going to, how are we going to set limits to make sure that this is gradual? That's very different to someone who's saying, I'm concerned about my future in 20 years' time. Yeah. So that can be really important to actually really try and dig deep on what is your motivation, and then what is my history, my medical history or my conditions, and sort of knowing kind of where you're likely to be headed and where you're likely to hit your snags, I suppose, as far as consistency. And one of the things that we will talk about in a minute around habit formation is that what the body needs for progressive strength and cardiovascular fitness change is very different from what the mind wants. So what the body needs is consistency and very gradual increases. And so for some of my patients, very gradual might be, we start with 5 minutes walking around the house, and then within maybe 3 weeks, we're doing 10 minutes of walking around the house, okay? Or it might be that we're going to start karate, but we're only going to we haven't done karate for 20 years. We haven't done any sort of exercise that really is going to put a lot of effort on your legs. So we're actually going to do 15 minutes, and we're going to go 4 times of just 15 minutes of the class before we increase. And that's really frustrating when your brain's going, I'm really motivated. So your body needs really gradual, slow increases. Your mind wants to tick boxes, and your mind wants to achieve. And the problem with achieving with exercise is it's actually how long is a piece of string. And so you want to find something that you can tolerate kind of forever, or that you train in cycles, or you do something for a cycle. I love the idea of people doing a Zumba for one term, and then the next term they've gone and done some water aerobics, and then the next, because actually that actually stimulates the kind of habit formation and reward pathways of your brain. It's not kind of what your body will kind of tolerate because you're going up, but the idea is consistency and slow, gradual incline. Whereas the brain wants to tick boxes and achieve and complete. Yeah. Michelle, were there any questions for me at this point?
I don't see any questions at the moment, but there was a comment here from Mandy. It makes my joints hurt, plus I'm nervous about re-injuring my knee. So there is that concern that, you've injured yourself in the past, you don't want to re-injure. How do you kind of overcome that fear?
Yeah. So I try and teach patients to, it's about asking the right questions to yourself. So you've made the commitment, yeah? We've had a talk about the actual program we're going to plan to do. So the program might be, it's home-based, it's with some weights, and we've worked through, 5 or 6 exercises, and we've worked through the resistance you're going to do, and you've got your little program. But then you go away, and now you're going to have to and you won't see me for 2 weeks, because that's what, might be the standard. And how are you going to know when to increase your weights, or when actually we need to change plans and you need to decrease your weights or have a rest day? And so what I try and tap in with patients is they need to have a conversation with themselves every day, especially when we're doing injury prevention. So with someone who's high risk of re-injury, or kind of this early stage when we are at a higher risk of injury, and saying, and basically I tend to give people a list, and here's my list. And I ask them to choose a question that kind of resonates with them, that they can do it really quickly. So we've agreed they're going to do their weight training 3 times a week, and here's your program, and I'll see you in 2 weeks. So you're going to have done it 6 times, and I'm hoping, with my knowledge, that we're not going to stress that knee, okay? But what I ask them to measure is before the exercise. So some of the questions are how do I feel right now? So are you already going into the exercise feeling exhausted? And remember, this comes back to what is your motivation? Or are you coming into this exercise going, I gotta get the results. I've got to do this thing. I've got a holiday in 6 weeks' time, and I really want to walk the Grand Canyon, and so I've got to get strong. So already we've talked about that you're kind of sitting in that category that's likely to go too hard. So let's have a moment before we start the exercise to say, how am I feeling right now? Am I actually really pumped and I'm more likely to go bananas? And so here's my little program. Actually, I do have a bit of a twinge already in my calf. So that sort of check-in and going, okay, how am I feeling? I'm feeling really good and I'm feeling super motivated, but my calf is already sore because I got off the tram badly this morning. Okay, so let's think about, as I'm doing the exercise, if that calf keeps pulling, I might need to stop or I might need to adjust. So it's that conversation with yourself. Have I had enough rest and sleep? So that can be a massive factor. Do I have any lingering soreness or tightness that I need to kind of consider? So that awareness, if you're from a footy world, you always hear about footy players talking about hamstring awareness. And that's the same thing we need to do. If you have an injury, before you start, you need to think, how aware of this dicky shoulder am I right now? Okay. And how's my motivation, as we said. Then during the exercise, and some of my patients who I'm wanting them to really check their motivation, because they're sitting on that like, I am a goer, and it's I'm a goer here, not necessarily what's happening in their body. I might actually write it into the program saying, you're halfway through your program, score yourself on a 0 to 10, how much pain or discomfort am I in? And if the discomfort is past a 5, or whatever we've worked out based on your condition, then I actually need to abort mission. Yeah. Or another one might be, how do I muscle sphere? So some of my post-surgical patients, we'll often talk about, you need to stop and just check in. How is your body feeling? We want to go slow and gradually. We don't want peaks and troughs, and we definitely don't want to exacerbate those niggles. So we do a pre-exercise kind of check-in with the body, and I give them this list and we sort of talk through what are the things that resonate with you from this language and these questions. Then during exercise, how am I going? If I'm fairly sensitive to what's happening with my pelvis, so I have some pelvic shearing, maybe post-pregnancy or pre, checking in while I'm doing this, how's it going? How am I feeling? Do I need to change plans? Yeah. And then post-exercise, we often would have a bit of a think about it afterwards. How hard did I work? Was that a 3 out of 10 or was that a 10 out of 10? And then I love the next morning kind of exercise? Do I have carryover pain? Do we have delayed onset muscle soreness if we're building strength? Or is this a good pain, or actually have I started to do the niggle? So I love the self-check-in. That's one of the ways we prevent and we sort of protect ourselves against the aches and pains. That's very cognitive. The physical stuff around protecting yourself against aches and pains is wear the right shoes. If you've got loose skin and that is a problem, you need to think about some anti-chafe and some good compression or sort of skin maintenance, compression sort of garments or skin protecting garments. Do a warm-up. Like, it's really boring, but it's as in everyone knows to do it and no one does it, but it really makes the difference. The literature really supports this concept of warm-ups that none of us really kind of worry about, but it does make a really good difference. Rest. So we now sort of the literature and what we support is active rest. So if you're someone who goes does sort of a moderate or community level of exercise, active rest might be a walk around the block. But if you're someone where your exercise is a walk to the letterbox and back, and I see great people where that's our goal that we're working on, we might do 3 walks to the letterbox and back. Their active rest might be lying in bed and doing some pelvic tilting, yeah, and some arms above head. So active rest is very different for everyone. And as a very kind of non-clinical, this is not based in literature, it's just what I think about. I think about sort of a quarter to a third the effort of whatever your active day was, that might be active rest. Yeah. So as I said, if your sort of active day or your exercise day is 5 minutes of exercise, standing at the kitchen bench and where you're working through a program, that might be 1 to 2 minutes, or it might be some lying kind of stretching stuff. Yep, for a sort of active rest. Because remember, we're looking for gradual and consistency. So the key things, sorry, just to summarize, the key things around avoiding the aches and pains from a physical point of view, motivations are, and what's likely to be kind of when you start exercising and when you do it, you know, which way you're going to kind of tend to go. And then also really thinking about how I check in with my body as I do it, self-awareness. And then how do we set up kind of the practical bits around, should we be loading that joint? Should we be loading the cardiovascular system? This is based on your condition. And then the basics around wear the right stuff, make sure you're hydrated. Just doing exercise hungry is not a great plan. And there's some of the kind of really basic building blocks to help someone avoid the kind of mental and physical aches and pains related to starting exercise. How much exercise is enough is a really tricky question. So the kind of guidelines for Australia are 150 minutes or moderate intensity create guilt if you're a long way off from that, and fear. And I think if you're doing way more than that, they equally get this almost competitive or this competition kind of brain. So I don't find that particularly useful. What we want is to know what the expected outcome of any exercise you do. So if you are strength training, we want you to have some muscle soreness, and you need to know the difference between muscle soreness, which is the micro tearing of your muscle to get stronger, versus joint soreness, because we've not got in the right position, or it hasn't been a good exercise for you. And so we expect sort of a little bit of muscle soreness, but we want it to come 1 to 2 days after you do that heavy weightlifting or strength training. If it comes in the afternoon and you did it in the morning, we've gone too hard. And teaching those sort of things around teaching that the self-awareness, and that's what I do often, is say, okay, here's your program, and this is kind of the level of kind of fatigue or soreness or challenge I want you to work to, and then we titrate it as we go. So there are some sort of physiological numbers that a physio or an exercise physiologist or your local gym person can tell you should be wanting to achieve if you're achieving sort of if you're sort of exercising with a really clear goal in mind. Around sort of strength training or cardiovascular fitness, we often talk about the Borg scale, so the level of breathlessness. So we want most people to work at about a 3 out of 10 on a Borg scale of breathlessness when they're doing cardiovascular fitness. All of that is very technical. In reality, how much exercise is enough depends very much on your goal, and it depends very much on how we can fit it into your lifestyle. So how much exercise is enough is very dependent on what your motivation is. So if your motivation is, I'm concerned about the 20-year future, then probably we are looking for a fair bit of cardiovascular fitness, and so walking is a great thing, and we try and fit it in where we can. If your motivation is to complement GLP-1s or medication, that needs to be much more nuanced with what else is happening from a dietary perspective. But not exercising when you're hungry or likely to have no calories on board is not a great plan. So that's probably kind of how much exercise. When you have injury or fatigue, so a lot of my patients where we do a lot of fatigue management, the right amount of exercise is that they're not stuffed. Yeah, so having a great exercise session and then needing to sleep all afternoon, or not being able to look after your kids, or going to bed at 5 p.m. is not the right amount of exercise. So the right amount, we want gradual incline or increase, but we don't want consequence that means that it impacts into your quality of life and your social life and your fun life and your work life and your kid life. So hence, I never get too hung up on the kind of Australian guidelines around exercise. It's incredibly nuanced to what your capability is and what we're trying to achieve. So if you have a holiday in a couple of weeks and you're wanting to, I think I saw one of my patients here who's wanting to walk up a Queenslander who has a flight of stairs, Queenslanders with big stairs. That goal is very clear, and we've got a very clear time frame. So how are we going to break that down to get there in 6 weeks? Yeah. Whereas if the goal is this 20-year, I want to avoid poor health, we would be, and there's not really particularly any physical limitations that we're trying to kind of manage. It would be much more based on the guidelines. That makes sense. So that's really important. Again, it goes back to this: what is my motivation? And it's okay if your motivation is not that internal I love exercise. Yeah. That is a very common thing. And when we make exercise, so what are some ways we can do to make exercise sustainable? Basically to make it enjoyable and affordable, and take away the barriers. So habit formation, or choosing these habits is a muscle that you need to flex, and you need to practice it. So you need to take out as much friction to the process of getting it done as possible. That makes sense. So if you hate exercise, get a but you love podcasts, or you love TV, or a TV show, or they're probably like two of the ones we use all the time. You don't need to love exercise, but you do want to exercise because you feel that it's important for your goal. Save the podcast or save the TV show for the exercise you're going to tolerate do. Yeah. If one of the key factors for you is being in public and being around the skinny minis and feeling really visible in a gym space or a pool, or even walking in your street, then that's not going to be sustainable. And you actually are going to fall off the bandwagon if every time you go to exercise, you actually really dislike it. Okay. And you feel very, very visible. So what can we do within your home? Or can you drive somewhere where you feel there's less people? Or can we do this virtually? But if you actually do not enjoy the going to the gym and you feel really visible there, the reality of it is you're probably not going to stick at it. Yeah. And it's about having that conversation and really thinking through. We're not looking for a 6-week fix. We're looking for gradual, like, I want you to be, because I really believe that exercise is very important for your health. I want you to be doing exercise at Christmas. It might not be the same exercise, because we might be deciding you're going to do 4 terms worth of 4 different exercises, different community groups. Or we might be working in 6-week blocks, and the 6-week block is all we can tolerate at the moment, even though we know we're going to go another 6-week block. But it's how do you reduce the friction to make this sustainable? So exercising while you're cooking, or while you're waiting for something, while you're waiting for the coffee or the tea to boil, or the kettle to boil, that's the word I'm thinking of. Those really practical little things, if that works for you, is awesome. Yeah. I was speaking to a woman today who we were trying to link the exercise she was wanting to do with her teeth brushing, but sometimes she forgets to do her teeth. And so, we were talking about she never forgets to have lunch. So we've now called lunch, we actually wrote it out, and it's called LEXNCH, because lunch is now lunch exercise, but however you want to say that. And the few things that we're doing to, so she's got some really clear goals around, she's got some issues with actually lifting her legs off the ground. So she's a bit of a shuffler, having some falls. So her exercises are going to happen at exercise lunch, which is now lunch exercise, whatever word you want to use, and that she is going to do them before she has her lunch, and that's her motivation. So she says she never forgets, because it's a pleasure for her to shut her laptop. She works from home, but now's the time she's going to do it. Yeah. For someone like me, I have to leave the house because I have to get away from the kids to it. And that's my pleasure. So not particularly that I'm driven for the exercise, but I'm quite driven for the alone time. And it's really important to me to put in a podcast. So we know the obvious, building accountability buddies. Yeah. So for family can be tricky to build accountability, especially if you feels linked with your body weight and feels linked around success and body weight. So family can be a tricky relationship around accountability, but for various other people, getting together and walking every morning, or walking with a neighbour, I mean, we don't let down our friends and family. Well, it seems easy to let down family, I would say. So it's actually less, making that commitment with someone else, the accountability. And I mean, this is all really simple stuff, but buying some new clothing that you like, so that you at least, and there are some new really great plus size fashion brands, sort of activewear brands coming on, and you know, treating yourself that I am going to start exercising and I'm actually going to find something that feels good. Again, the skin management is really important, because if the consequence of you doing the exercise means soreness or pain, the motivation is going to dwindle, because you're just thinking, oh, I have to do it again. So think about, what are the friction points to you actually getting it done? And how, if your brain and your world is fairly chaotic, habit stacking, and anyone with an ADHD diagnosis will be right all over habit stacking. But how do you find realistic habit stacking? Yeah. So we would think that everyone would brush their teeth every day, but that's not part of how my brain works. So, but I don't miss lunch, so I'm going to habit stack with my lunch, which was basically our lunch exercise combo today. So when I work with someone about how do we start, we really need to know our motivation. We really need to know our medical history and our kind of likelihood of what's going to happen if we treat our physical self badly. And then it's all about reducing the friction. And the friction is the bits that make it kind of unenjoyable, the truth that makes it unenjoyable. Yeah. So the truth might be, I feel much too visible, or the truth might be, my skin hurts, or I'm scared I'm going to wee myself. One, can we do anything to treat the bladder? Or two, that's not a great exercise if actually you're dreading it because you think you're going to go and wee yourself, or fart if you do a down dog. Those sort of things. And if you're actually not going to enjoy it at all, almost guaranteed in 6 months' time, you're not going to be doing it, because it actually wasn't fun and it came with friction or feeling not good about yourself. Any questions, Michelle, or anyone wanting to sort of check in? I feel like I'm very good at chatting.
I think it's great information. I love what you're talking about in terms of making it gradual and also making it fit within your life, and that habit stacking. Late last year, I came to the realization that my afternoons are very busy driving the kids around to all of their different sports. And then I'd get to the end of the day, I'm thinking, I haven't had time to do my exercise because I'm kind of standing on the sideline for them to do it. So just I made a conscious habit of when I take my son to soccer training, I'm going to take my shoes as well, and that's just a quick pair of shoes that I have to put on, and I'm just going to walk around the oval while he's doing it, rather than kind of stand and chat. And other parents decided to join, funnily enough. So it then became lots of us kind of getting that exercise. But I love that concept of finding what's right for you, that's going to fit into your life, because you're right. If there is too much friction, if I don't feel comfortable going to the gym because I don't know what the machines are, I don't fit in because I look different to all these skinny people, you're right, you're not going to do it.
And the other thing is that change requires change, and change is really hard, and recognizing that. So if you want to be in a different place to where you are now, you actually have to do something different. There's no way around that. But also kind of creating those getting started building blocks is really tricky. And then doing it when you have prior conditions or medical things going on, where you're sort of thinking, I don't know what the right thing is for me, is really challenging. And sort of in response to that, I have created this sort of 6-week program. And really what we do is, for most of my patients, we telehealth once a week, and I really go into detail about what their motivations are, what their conditions are, and what habit formation works. So we're trying to really unpick those sticking points and kind of trying to work out what works for them. And then we text almost every day. So we text Monday to Friday. So I normally spend the morning texting my patients, and it's about creating that accountability. And I did that because I kept having this scenario where we'd have these great discussions and great plans, and then I'd see someone in a fortnight or a week later and they'd say, I didn't get to it. It didn't happen, or it was raining, or it was hot, or my knees went bung and then I didn't know what to do because I couldn't get on, I couldn't see you for a week. So we made this, I just sort of thought, well, what I actually need is that we can do real time change of plans, but also that I'm there being like, come on, you told me you were going to do this. And I talk about this concept of barriers versus challenges. A barrier is a genuine reason why the plan needs to change. So I've got the plan was I'm going to do this week, but I've got COVID and I feel really terrible and I can't breathe. That's a genuine, I can't do it. We need to change the plan. A challenge needs challenging. So the challenge is, it's hot today. Okay, but we were going to do a 10-minute walk. So can you do it right now? Or do you need to go to the mall where it's air conditioned? Or can you walk within your house? Or the kids are coming over and I didn't expect them to. Okay, well, you were going to do a 20-minute strength training program for your core because you potentially have had a surgery and we've got some back and core weakness. The kids are coming over. Can the kids do? That was what, that's a challenge. The challenge needs challenging. The barrier is real. And it is amazing over that 6 weeks, almost always. It goes from me doing the morning text, being like, what was our plan? How are you going? What's happening? Blah, blah, blah. To week 5 or 6, I've already done it, blah, 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 letting you know I've got this plan, and the agency changes. So I talk about it a bit as stick and carrot, and that's the way that I could affordably be available and we could navigate the real life challenge. And that's been really powerful for a whole range of patients who are to able to kind of do that initiation with all of the kind of real life on top of it. And the real life conditions, and the real life as in health conditions, and the real life wobbles that happen from life. The work has increased, this. Okay, so what is the priority today? Can we change the plan? And what I also have started to do is we're going to start some group exercise. That was a way also to do cheap, cost effective, have some access to the accountability to do the weekly exercise program, and it would be your program. And then how do we how do we make it affordable, but we're able to make the adjustments as we go? And so talking to you last week, Michelle, I was like, what I could do is put that together and have 6 weeks. We text every day if that's, where you want to be. And then we do our exercise every week as a group, but small group, 5 people, you're doing your own little program, your own kind of what are we working on program. So is it about knee rehab, or is it about a generalized program to build your strength sort of total? We catch up on the Friday and we talk about habit formation, and this is all via telehealth. So that has been really powerful for a range of my patients, to be able to kind of actually do this initiation and get past the real life bits that make it really tricky.
Yeah, absolutely. I love that, Nadia. And what I'm going to do, I'm just going to drop a little link into the chat for everybody. If you want to find out more information about Nadia's program, you can pop your contact details in that form, and Nadia will get in contact with you individually, just to see where you're at, what your motivations are, what your goals are, what your challenges are, etc. So that is something that is in the chat and available to you. Nadia, what I like about that is the accountability, because you know, if my exercise is I take the dog for a walk for 15 minutes a day, but it's raining or it's boiling hot, which it has been right now, it's very easy not to go. It's really easy not to go. And having
Yeah.
that accountability to keep the momentum, because you're right, consistency is the key, right? Because if you do it for a week, then the eighth day is easy to do, and the ninth day is easier to do, and you can continue that momentum. When you stop and start, I think that's probably, and correct me if I'm wrong, that's probably where the injuries start to, you know, kind of get more prevalent when you're doing that. So I love that accountability side of this. And I don't know about everybody in the chat, but you're so approachable. I just feel like I can tell you everything about, you know, my concerns, and you get it. You get what it's like for people in larger bodies and the challenges that they have every day, because that is exactly what you do. And you've raised so many things within your conversation that that I didn't even think about might have been, you know, a roadblock or something like that. So I think that is your knowledge and expertise in that area is incredible. So that would be a good opportunity for anyone on the call who, you know, potentially wants to take advantage of that.
And
Now,
Michelle, I just wanted to say about the accountability. I stoop low. I always start clinical, and I sort of start with, is this a barrier or a challenge, Michelle? This would be my classic, you're saying, oh, it's raining. And I'd say, Michelle, is this a challenge or a barrier? And then we might have that chat. And then you might say, then I might say, and you say, oh, actually, maybe I feel like I can't really fit it in or whatever. And it starts, that happens. And I start with, but we talked about quite clearly that your goal is to walk the Grand Canyon in 6 weeks or 8 weeks or 10 weeks, whatever the goal is, or the goal is that you want to be able to enjoy this holiday that's going to require lots of steps and carrying my bags, blah, blah, blah. And you go, yeah, I hear you, but I'm really not sure. And this is after I've said it, you're going to just put your coat on and kind of go for it. And then I go to, you've paid me for this motivation. Like I really go low. And often I reckon that's the last one, when it's like, you're paying me to hold your hand. I'm now throwing the stick at you. And it's really interesting. There's really no limits. But it really is about teaching you a barrier, but not teaching you cognitively. If we all just work from the cognitive brain, you'd get your shit done. We'd all get our shit done, but that's too simple. Yeah. We need to kind of actually learn it deeply. And that's that bit where it's like, I can logically tell you actually can just go out in the rain and do it. Yeah.
but my excuse that that the dog smells when it's wet.
That's right. And it's not going to be that. Yeah, and it's not going to be that pleasurable. But change requires change, and it's not that easy. And those incrementals, and that's what our bodies need, is that incremental change. And look, the walking the dog is a simple thing. I don't often see patients that it's just about walking a dog. We have serious clinical conditions that we're trying to actually get from A to B to improve people's function, but it is really interesting. I would pick and look, as soon as we find it's a barrier, we change course. But we need to challenge the challenge, and that's what's going on up here.
Yeah, fantastic. That's really useful information. We've got a comment here. Every time I do too much exercise, I have DOMS after 24 hours. How much should it really hurt in my glutes and hamstrings? I love that question, because what resonated with me when you were talking before was that there's a couple of different types of pain. There's pain where you've actually injured something, and there's pain because you're starting to move those muscles in a different way that you haven't moved them for a while.
Yeah. So the question to start with is the pain sort of expected and relative, to what's happened. So for example, I have been in a very fun holiday mode and haven't gymmed for 6 weeks. I went to the gym on the weekend and I could barely get myself onto the toilet yesterday. You know, I expected that much pain. Okay. Oh, sorry, I didn't expect it, but it's reasonable for how much I did and what I did. So DOMS is delayed onset muscle soreness. It's micro tearing of muscles. And then what happens if you think about some lace? So you've got some material, you work the muscle hard enough that it has some tears and it looks a bit lacy, excuse me for my ugly nail. And then the muscle gets filled in with more muscle and it becomes bigger and stronger, okay? So that's the concept of DOMS, and it hurts a little bit. We want DOMS to come in 24 to 48 hours after exercise if you're on a regular training pattern, okay? If you are going to the gym and doing the same thing-ish every 2 days or 3 days and you're still getting the same DOMS from the same exercise, I'd be interested in if it's really DOMS, okay? Because your muscle isn't responding to the same load, yeah? So if every time, the difference is if you go to the gym, do the hard work or do the strength training, do the hard work or do the hill climb. That's another great one to give you the bum burn. And then you have such awful DOMS, you take 3 weeks off to recover emotionally and physically. And then you do it again and you get the same response. I mean, that makes sense that it's DOMS, okay? So because you're not actually consistently and on a gradual level loading the muscle. It's too far between drinks, okay? But if you're doing the same thing quite regularly, so, you know, sort of 3 to 5 days in between, and you're getting the same pain, it doesn't sound like DOMS to me, obviously, not knowing your specific condition and kind of your experience. But that doesn't sound like DOMS to me. So DOMS, we want 24 to 48 hours after, roughly. And we want there's actually probably no limit to how sore it is because people's pain receptors are different. But what we want is that it probably only lasts 1 to 2 to 3 days. So actually, if you have DOMS and a week later, you're still feeling it, you've actually torn the muscle, and the difference between DOMS tearing versus a tear is a little bit theoretical, but you've moved into an injury state and you probably need to go into some active rest. And I know there's some beautiful exercise physiologists on, so I'm hoping that I'm not butchering. I'm talking in generals, but I'm hoping I'm not butchering the literature too much. But in practice, that's really what I would be. We would talk about, and that's what we'd be working through. Yeah.
Just on that topic there, we have Sophie who's asked a question. Thank you for sharing your knowledge and insights. What do you think is the most important or key thing that an exercise physiologist can do to support people in larger bodies?
Well, there's people in larger bodies here that might like to weigh in because they're your customer. From my point of view, it's not one size fits all as far as what the goals are, what someone's health is like and capability is like. And I would treat anyone at any body weight exactly the same. I would do goal setting. I would do some stress testing or sort of fitness testing. And once I built a relationship, and especially if I was in a gym space, sort of a standard exercise physiology gym space, I would talk to them about whether they feel comfortable on different bits of equipment. You know, we'd sort of talk about their comfort levels, but assuming they've come to you and into their space. But yeah, I mean, there's beautiful people here with lived experience that will can probably tell you more than what I think. You know, I think it's about treating everyone the same, but also acknowledging that bigger bodies actually have different biomechanics and physically won't fit on certain bits of equipment, and we don't want to make, you know, like there's some practicals about that and understanding that the body is a different shape, and the forces are different, but actually the treatment or the care is patient-centered. But yeah, I mean, I would love to hear if anyone else.
Absolutely. Yeah, fantastic. We've got another question here. One of the injuries I get is from being in a larger body is my apron stomach gets in the way. It's like I'm trapped. How do I work with this? Do you have any practical tips?
Yeah. So sometimes an apron can be tricky in lying down position and standing up position. You might manage it differently. So if you're doing sort of some walking and the apron's hanging down and is uncomfortable, or so you're in an upright position and it's sort of the hanging and it's like a physical barrier, it's often very good practice to lift it up. Yeah. So if we were doing some exercises in standing, we would physically lift it up. But equally, there's some really nice compression garments but basically we're just wanting to strap it in for any level of sort of jumping, or I'm not assuming that you'll do a lot of jumping, but sort of anything that kind of is going to throw a mass around that will just feel really uncomfortable. But so mostly we would be kind of looking at sort of some compression to hold it. I also do lots of exercise with patients with aprons, and I think other health providers need to be comfortable to say, look, it'll be easier if you lift your apron up and hold your apron up. Yep. And so that we can challenge the legs that are just actually working the leg muscles, not also with a mass over the top. In lying, some patients, some of our bigger patients in lie feel really uncomfortable flat lying. Yeah, because the tummy pushes up into the abdomen and then, into the sort of diaphragm, and breathing is really tricky. So I would rarely get a bigger patient. So it sort of becomes a bit of a level, but I would really have a conversation with a patient about whether lying is okay or impacts their breathing. And then sometimes with a pannus, we would actually physically push it down so that if we are needing to be fairly flat, we actually can support some air sort of coming in. And for other people, if we're doing some leg exercises, again, we might be holding it. Yep. There's also, again, this depends on how often I'm seeing patients, but some of our NDIS patients who I'm seeing for quite some time, we have bought some like wetsuit material kind of belts, and so that we can actually kind of contain, so we can really focus on what we're trying to do as far as strengthening the muscles underneath. But it's really tricky, and I think I work in this space, so people come to me knowing that we're going to talk about this, and I'm very happy to kind of have that conversation about, okay, what feels right for you to manage it and lift it up and things. I think more healthcare providers need to acknowledge that there is a big pannus there or a skin there, and so how can we continue to do the exercise we need to do, or the treatment we need to do, or the care we need to do? And you might have to have a conversation with your patient. Hurrah, imagine that, saying, how would you be most comfortable? I need to access your hip, or I need to do this for treatment. How might you be most comfortable for me to move your pannus out of the way, or to get this exercise done? So conversation with your patients, they know best, like it's their body. But also in practice, if I was going for sort of upright things, we're looking to compress it and hold it down so it's not wobbling around and feeling really loose. And it can absolutely be a factor in falls, loose skin pannuses, if someone is weak and older and has not great balance. So absolutely a factor. These are the things that we need to acknowledge. Bigger bodies are different. They have different biomechanics.
Wow, your knowledge amazes me all the time, every time I hear you speak, Nadia. We've got a comment from Nicola. Well said, Nadia. Treat people the same, but do think practically about the space and equipment that is required.
if anyone wants to open a plus size gym, I'll be so keen. Just don't know if I have the time or energy, but I would love to invest.
Absolutely. Fantastic. Well, thank you very much, all of our participants, for joining us this evening. Great comments and really interesting, thought-provoking ideas that have come up in this session. So please, I do encourage you to click on that link that's in the chat and get in touch with Nadia, because she's incredible at what she does, but also the empathy that she shows. I've had meetings be delayed with Nadia because she's, had an upset patient and has put other things aside to take care of their needs. So if you're looking for empathy, if you're looking for that wealth of knowledge and experience, then Nadia is certainly the right place to go. Nadia, have you got any final comments in terms of how you can get started with exercise? Any final motivational comments?
Yeah. Be kind to yourself. Yeah. And be realistic. Remove the friction points, whatever they are for you. And looking at what someone else is doing, someone else in a bigger body, someone else in a smaller body, doesn't help. You actually need to understand your motivators and what's going on in your life, and then kind of work through that for you, not anyone else. Looking over at someone else and going, oh, but they're able to get up at 4 a.m. and blah, blah. Why can't I do that? Doesn't help. It doesn't get it done. Yeah.
Absolutely. That's great advice. Thank you so much. We've just had one little question just pop in last minute. Would any of the costs be covered by health insurance?
Yeah, absolutely. So what we can do, and I'm hoping that, sorry, I shouldn't talk about scrunching the system. That's what I was going to say. So basically what we would do is we divide, so it counts as 6 physio sessions over the 6 weeks, and then 6 exercise sessions. And we would just divide the total cost over those, and then you can, NDIS should be okay, obviously, depending on people's plans. And obviously you get 5 EPCs a year, your chronic care plans. We can definitely apply those, and private health insurance should be right, assuming, I mean, you can always ring. I'm happy to give you the code of what the sort of code that goes to the private health insurance, and you can ring your health insurer. But yes, essentially they'll come in as physio exercise and physio sessions.
Yeah, fantastic. So I think that, reach out to Nadia. She can, kind of chat with you in terms of what your certain requirements and things are. And she should be able to help with that. So that is fantastic. Wonderful. Thank you so much for your time this evening, Nadia. We appreciate everybody being in the audience tonight. We hope you've got a few little tips and tricks up your sleeve, and certainly, some motivation to get started consistently, not too big to start with, and in a really safe way. So thank you very much, everybody. Thanks for your beautiful comments in the chat. Really appreciate that, and have a great evening, and we'll hopefully see you soon. Thanks very much. Good night.
Thanks, everyone.